Hello and welcome to Tuesday Talks, brought to you by General Practice Solutions. I'm your host Jenny and thank you for joining us. Each week, we bring you practical insights to help primary care organizations improve operations, meet national standards, and deliver better patient care. Today we're focusing on workforce, specifically, the Additional Roles Reimbursement Scheme, also known as ARRS. This scheme has created new opportunities for primary care networks to expand their teams with a broader range of healthcare professionals. But with that opportunity comes complexity, from recruitment and onboarding to management, training, and compliance. At General Practice Solutions, we offer end-to-end support to help practices and PCNs get the most out of their ARRS funding without the headaches. Let's start with a quick overview. The Additional Roles Reimbursement Scheme is part of the NHS long-term plan and aims to grow the primary care workforce by reimbursing PCNs for employing new clinical and non-clinical roles such as social prescribing link workers, pharmacists, paramedics, mental health practitioners, and more. The idea is simple: to reduce pressure on GPS, diversify the skill mix within practices, and improve patient access to appropriate care. But putting it into practice can be challenging. Recruitment takes time, the application process can be detailed, and managing a multi-professional team requires planning, oversight, and clear governance structures. That's where our ARRS staffing service comes in. At General Practice Solutions, we support PCNs through the entire staffing lifecycle, from workforce planning to long-term team integration. That includes identifying which roles best suit your population's needs, preparing job descriptions, managing recruitment, and ensuring all funding and reporting requirements are met. Our team works closely with yours to provide workforce mapping to assess current gaps and identify which ARRS roles would bring the greatest benefit. Recruitment and onboarding, including advertising, vetting, interviews, contracts, and induction. Ongoing HR support, covering performance management, training coordination, and line management structures. Administrative and financial compliance, making sure your funding claims are correct and timely. Strategic workforce planning, to future-proof your team and embed new roles into your long-term model. We also ensure that your PCN doesn't just fill roles, but fills them effectively. That means supporting supervision and development, aligning new roles with existing services, and making sure you meet the requirements laid out in national guidance. For many PCNs, one of the biggest challenges is simply capacity. You're busy running services. You may not have the in-house HR or administrative bandwidth to take on more. That's where our support makes all the difference. Whether you need one role filled or a full multidisciplinary team developed, we're here to help you build the workforce your community needs in a sustainable, well-supported way. To find out more or to schedule a consultation, visit us at www.generalpracticesolutions.net. Call us on 0208 865 1942 or email us at inquiries@generalpracticesolutions.net. Thanks for joining us on Tuesday Talks. We'll be back next week with more expert insights to support your practice, your team, and your patients.